All right, so here are the special considerations, but we'll go through each one individually. And what's interesting, again, the same thing that we talked about with we were doing with inappropriate elimination, we'll look at these same things in a shelter environment too. They're all the same. So there's the same things that we look at, whether it's in a practice setting or a home setting or if it's in a shelter environment. We just have to tweak it a little bit. Okay, so some of the physical changes. Now, this is my Cassie. I live on a couple acres out in Oregon, Wisconsin, so just south of Madison, so it was right on our property. And but what happens is that there's a slowing down. You know, it's kind of a general slowing down is the way I would describe it. You know, their ability to respond to infection is much more prolonged, and the healing process takes longer. Well, this something really hit me is I had like an abrasion on my arm. When I realized I was getting a little bit older, is that how long it took for that to heal. It's like, this is so much longer. So, and that's true with dogs and cats, is that the healing process takes longer. And they have slower metabolisms, and they're producing this hormone, so that means their intolerance of extreme heat and cold is much tighter, meaning that they can't tolerate it as well. So we have to really consider that as well. Okay. And then the big thing here is probably sensory changes. You know, the sight, touch, smell, but it can be subtle too. My dog Roz, who is right here with me right now, right here, she is, so we think she's probably about 14 or so. But the last year, I've definitely seen a difference. I mean, this is she's a border collie, so she's all over the place, you know. Now she's just a little bit slower when she's, responding to things. Her hearing is definitely going, She hates having her picture taken. I can actually go ahead and get my camera. You know how that does that little ding when it first comes on? Before, she would just run up the stairs if I were to do that. Now I can actually turn it on, and she doesn't hear it. So I'm able to take actually more pictures of her now. But definitely it's something that's, I would say, in the last year. And now she's having a little hard time getting up and down the stairs. The sensory things may escape notice at first, but you'll start seeing a difference usually with time. But the most important thing, the message here, the best remedy, is keep them active. So doing things like going on walks, going ahead and doing training with them, keeping them sharp, play. It may be in a little bit different capacity, but all the things it's the same principles that apply. Is keeping them active, keeping them sharp. Now, something to need to consider here too from a physical change is pain assessment. Actually, what AHA is recommending is that pain assessment considered the fourth vital sign. The first three being respiration, heartbeat, temperature. Now it'd be pain. And if you think about it, that's probably really true. Because what we want to do is we want to be able to, once we've assessed that pain, we want to be able to manage it. What's the most common thing we probably see from a pain standpoint, at least from a chronic pain standpoint in older animals? Arthritis. Real common, you guys. And it can be very uncomfortable. Probably more of an issue with larger breed dogs than the smaller ones or even cats, but cats can get arthritic as well. So we need to address that pain to make them feel comfortable, right? And it's so great is that we have, veterinary medicine has come so far. There's so many things that we can address that we couldn't have, even when I graduated from vet school. That, like the Rimadyl is a big thing. That wasn't out there when I first got out of school. And it's because of the advances in veterinary medicine, just like it is with human medicine, and how we're understanding better how we should feed our animals, how we should eat ourselves, that we're living longer. People are living longer and pets are living longer. So these are things we need to think about. But we have to identify the pain, we've got to prevent it if we can, and we have to minimize it, right? So what, as far as prevention could you do? Well, you could think about maybe a softer bed that they could lay on, right? That could prevent them from when they would sleep and then they get up and they're painful. So this is something that's real important, and it's no different in a shelter environment. So here's a long list, you guys. I don't expect you to memorize this, but these are signs of problems. I wanted you to have that list just if you took it back to your organization, you want to say, oh, this is something we should be aware of, that there's a problem. Things like change, a sudden weight loss, or vomiting, diarrhea, or they lose interest in a particular task that they used to love before, like they used to love to play with a ball or something like that. These can all be normal aging signs, or it could be signs of problems too. Because we have to always consider the medical component of this. In many cases, they can be addressed. So the most common problem we see with aging is inappropriate elimination. You guys see, what does Cassie have on her there? A diaper. Okay. As she got in her last year, she got to the point where she just couldn't hold it anymore. And of course, I did all the lab work, and she wasn't in renal failure. She didn't have diabetes. She just was getting to the point that she just couldn't hold it as long as she used to. So, so we ended up, and the diaper worked out just fine actually, and she was fine with it. But that's probably the most common problems, because the idea is that the kidneys of the organs are probably the ones that age the quickest and are affected the most. But there can be disease. So just because they're urinating in the house doesn't mean they're just losing their potty training abilities. There may be something going on. You got to rule out kidney disease. You've got to rule out diabetes. You've got to rule out a urinary tract infection. Because remember, as we age, we're more prone to infection. So still the medical components have to be considered. But that is the most common problem that we see in physical changes. Okay, behavioral changes. You may see some age-related cognitive changes, but they're usually pretty subtle. That's my son with my cat Butch, so a couple of years ago. Sorry, I use him all the time, much to his chagrin. But these are the things that we'll typically see from a behavior standpoint. There may be some changes in their orientation. So they go outside and they can't remember why they went out. Or there may be, all of a sudden, and this can be a sign of cognitive dysfunction syndrome in dogs, but they'll get stuck in a corner. Those are severe. Usually are much more subtle. Like, I'll give you an example, is Roz with her hearing now, is that she was sitting outside, and this happens quite a bit now, and I'll come out and I'll say, hey, girls, come on in, and all of a sudden she'll hear my voice, but she doesn't realize I'm coming over here. She'll go, "Row, row, row, row." Then all of a sudden I say, honey, I'm over here, and then she'll turn around and see me. So that's definitely a change that I've seen, as she's gotten older, is that she's having a harder time orienting herself. There may be less social interaction with other pets and yourself. That can happen too. Sometimes when they're painful, actually, is that they may not even want to be petted because it hurts. So you might find them snapping or something like that. That's why the medical side has to be addressed. They may, groom themselves less. They have some exercise intolerance. They tend to sleep a lot more. So we've got Roz and Cassie here sleeping together. Changes in their eating patterns. Like one of the things, Cassie, she loved to eat. And as she got older, her appetite really was impacted. And that's when I knew things were getting, there was a change. So, but you realize that these behavioral changes may be just behavioral changes of aging, but it can be an indicator that there's something going on medically. So please be aware of that. All right. So just, remember that medical problems, I got ahead of myself here. Medical problems may mask themselves as behavior, problems. Now, as we age, sometimes we have a change in nutritional needs. So pets do as well. So there might be, sometimes you might need to have more canned food, because it's harder you don't have as many teeth. They don't have, or it's harder for them to chew on the hard food as much. But also, you can have prescription medication, prescription food for organ-related problems. Things like there's one for kidney disease, there's one for diabetes, there's one for weight loss, which again is probably the most common problem we see in all animals is obesity. So that can all be taken into consideration here as well. All right, decreased activity. As our pets age, they don't do as much. So it all comes back to, like you were saying too, the best thing we can do, the way we can try to prevent this, is keep them active, just like ourselves, right? Keep them active. My mom is 75 years old, and she's so busy. I'm always like, you know what? I said, it must be hard to be retired. She's had a more active social life than I've ever had in my entire life, and it's really embarrassing. But it's because she's so active. I really believe that she's aged very well, and she's still lives alone and independently and does great. And the same thing is true with our pets. It's just keeping them active, and exercise is a big part of that. All right. Environment is in the consistency. So we want to do things as we don't want to move furniture around a lot, right? Especially because their vision might be affected a little bit. We don't want to do any major changes in schedules, because that's something that could really, seriously impact them. And just really a consistent routine as much as possible. I realize that there's going to be some days that, if something comes up, but as much as possible, try to keep a regular routine. It's probably more important with our senior pets.